The Practical Approach to Care Kit, or PAC, is a program that aims to equip health workers to manage all common adult conditions, whether communicable or non-communicable, acute or chronic, at primary care level. It comprises practice guides and an implementation strategy. It has been developed by the Knowledge Translation Unit of the University of Cape Town Lung Institute over a period of 12 years, tested in a series of randomized controlled trials, and its precursor scaled up to reach 20,000 health workers in South Africa. PAC is underpinned by 4 principles. The guides align with local policies and, where feasible, are evidence-based. The implementation strategy of educational outreach has been proven to change practice. Training occurs in primary care teams to facilitate task sharing. And a cascade model of training allows for rapid scale-up. PAC currently comprises of PAC Adult, a comprehensive clinical guideline with an approach to common symptoms and conditions among adults attending primary care, PAC Community Care Worker, for community-based lay health workers supporting people with chronic communicable and non-communicable conditions, and PAC Patient Information Leaflets, available in local languages and which reiterate key messages and are designed for use by clinicians or lay health workers. The PAC Adult Clinical Practice Guideline makes use of a syndromic approach, in that the starting point for navigating its contents is the patient's symptoms. 40 symptoms common in Southern Africa are included, each in a one-page format that first identifies if the patient needs urgent attention, and then guides the clinician through an algorithm of likely diagnoses, symptom management plans, and the identification of one or more chronic conditions. PAC Adult also caters for those people already diagnosed with a chronic condition, integrating their management into a single, user-friendly resource. 19 such chronic conditions are included, covering communicable diseases, chronic respiratory diseases, cardiovascular diseases and diabetes, mental health conditions, epilepsy, musculoskeletal disorders, women's health, and end-of-life care. Routine care has been standardized across all these conditions, using checklists for history, examination, and investigations, organized into a simple assess, advise, and treat format. Screening for common comorbidities is promoted, and referral of the patient needing adherence support to the community care worker clearly indicated. Throughout the guideline, medication has been color-coded according to prescriber level, communicating local policies as to who may prescribe what medication, at what dosage, and under what conditions. The guideline is updated annually to ensure that it reflects the latest policies and evidence. The PAC Community Care Worker Guide is designed to assist the lay health worker to provide patient education and adherence support for priority chronic conditions. Accompanying PAC patient information leaflets use simple and consistent messages to explain the patient's chronic condition, lifestyle advice, and promote treatment literacy. All the PAC programs use educational outreach as an implementation strategy, recognizing that training is more likely to change clinical practice if time between training and clinical decision-making is limited, and if it occurs over a prolonged period with learning and practice alternated. Educational outreach sessions are held on-site, lasting 1 to 2 hours, are repeated over several months, and are interactive, involving all facility staff. This minimizes disruption to clinical services, facilitates rapid application of what is learnt into practice, maximizes health worker training coverage, and promotes a team-based approach to primary care. The educational outreach training follows a narrative format using 25 cases, depicted in a waiting room scene. The cases have been carefully designed to facilitate use of the guideline, highlight its features and key messages, and build expertise incrementally, starting with single conditions and progressing to the management of people with multiple conditions and symptoms. Facility trainers also encourage health workers to bring their own cases to sessions to discuss with their team, reinforcing links between the guidelines' content and real-life care. Scale-up is made possible by a cascade model. The Knowledge Translation Unit trains nurse middle managers as master trainers, who in turn train nurses as facility trainers. These facility trainers deliver the on-site educational outreach sessions and are supported to embed the use of the guideline in a facility. Their training focuses not only on guideline content, but also on the educator skills needed to ensure that they can equip colleagues at clinic level to implement the guideline. This cascade model allows for rapid scale-up and integration of the program into the health system. The Knowledge Translation Unit led the adaptation of the PAC program for Botswana in partnership with local role players, and many countries are interested in using the program. The unit is now partnering with international collaborators, including British Medical Journal Group and Open University, to develop an adaptation toolkit to help countries tailor the program to their settings. Should you be interested in finding out more about the Knowledge Translation Unit or its programs, please visit our website www.knowledgetranslation.co.za.